3 roles you play in chronic illness and diabetes type 2 management.
Okay, so we often have patients that are referred to us when they're initially diagnosed with diabetes, primarily to educate them on how to manage their diet in terms of their diabetes. So that includes things like what sort of foods they're allowed to eat, what sort of foods they should avoid, when they should time their foods. So essentially educating them about how to control their diabetes using diet. So that's our main role in managing diabetes. Another role is follow-up of patients. So those who have entered hospital, for example, and then now because of diabetes that's poorly managed, they're often sent back to us to sort of follow up. They may not have a complete picture of how to manage their diabetes. Could be language. There could be language barriers. Often in this area we have all sorts of language barriers, social issues that can impact on how people manage their diabetes. So you have people here who come from a lot of backgrounds, different cuisine that they're used to, and they find it difficult to sort of let go, adapt and adjust. So if they have entered hospital and come out, they usually where are you going? They usually are sent back to us for a follow-up, and we sort of re-educate them on how to manage their diabetes.
Is that it?
That was 2 points
Okay.
now. I don't know what the third point is.
Alright, that's alright. How your role is distinct and how it overlaps.
Okay, our role is distinct because we're able to give patients complete, diet plans, for example. So we give them, for example, detailed food plans. So in order to manage their diabetes, and the way that it's a bit different. Sorry, what was the other one?
And how it's distinct.
How it's distinct. What do you mean how it's distinct?
Distinct from other roles.
I said that, and what was the second part?
And how your role is, how it overlaps.
Okay. The way that our role overlaps, so if we find that we need to refer patients to, other healthcare professionals involved in the management of diabetes, such as podiatrists, because often if diabetes is poorly controlled, you find that patients have, skin issues with their skin, with blood reaching, with, what do you call it? What's that thing called when the blood doesn't reach to? Often they'll have poor circulation, and so that can cause issues with their feet and with their toes and with the health of the skin. So we might refer them to a podiatrist, or often the diabetes has progressed so far and it's been so poorly controlled that it's caused issues with their kidney function. So we may need to refer to other healthcare professionals.
So just basic skills and challenges that you face in managing diabetes.
Skills and challenges?
Skills that you use and challenges that you face in managing type 2 diabetes.
Skills that we use, so most of it essentially comes down to providing patients with the knowledge that they don't have in order to control their diabetes. So it's educating them more about the right sort of foods to choose, also incorporating exercise plans. But the main challenge we face is trying to get across to patients the importance of managing diet in diabetes, because often implications are long term, they're not short term. So if diabetes is poorly controlled, it doesn't show up immediately, it shows up in the long term, and that's the primary challenge. People often don't realize that poorly controlled diabetes now means severe complications later on.
Thank you, Shireen, for your help today.
How was that?